Domestic violence is about power and control. It's a choice made by the abuser. COVID-19 may have separated us, but we're here to help. If you know of someone who needs to talk, please call the Florida Domestic Violence Hotline at 1-800-500-1119. Trained advocates are available to provide support. This message is sponsored by the Florida Department of Health, the Florida Department of Children and Families, the Florida Association of Broadcasters, and this radio station.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you. And I hope I never see you again. And I mean that in the nicest way possible.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, ladies and gentlemen, my friend from Florida and all around the country. I hope you're all staying safe. You know, the name of our show is You and Your Doctor Living Longer and Healthier. We don't have a doctor on tonight, but we got somebody really, it's very, very special. I've been talking to her about for 20 minutes, 30 minutes, and she's going to help you really get rid of most of your pain. Tonight we have a very special guest. Her name is Leslie Carmen. Am I correct, Carmen, that you run Karma Care Laser?
That's correct, yes. Thank you so much for having me on your show. Great to be here.
We'd love to have you. So tell us a little about your education. Tell us how you got into this thing, and
sure.
what does Common Laser Care do?
Okay, that's great. So I grew up in Zurich, Switzerland, and I went to a medical technical school there for 3 years, so I have some medical background. And when I came here to Florida, I obviously couldn't use that anymore because of the credits and so forth, so I did other things here. But in 2017, my daughter was diagnosed with a disease called trigeminal neuralgia. And for people who don't know what that is, it's facial pain. It presents itself as stabbing, shocks, crushing of your head, and the pain can be triggered by just talking or by brushing your teeth, or pain can just be triggered by nothing at all. And unfortunately, this disease is also called the suicide disease because it is the most painful disease known to mankind. So when my daughter had that, I was obviously very, very shocked at 17. She was a great ice hockey player, but her life just stopped from one moment to another. And I started going to neurologists, and the option they had was really just brain surgery on a lot of pain medication and anti-seizure medication, which she was allergic to. So we were stuck with, what are we going to do now? So I did a lot of research, and because coming from Zurich, Switzerland, we learn a lot about to first use homeopathic things, first take that route. And excuse me, I learned about laser therapy, and I did some research and saw that in Europe they were using laser therapy to heal the nerves, which trigeminal is a nerve issue. And then I did more research, found one place here in the United States that did that. We took her there. She got better, completely healed today, now 11 years later. And so I decided when she got better, I said, I can't just go back to my regular job that I had. Excuse me. I said, I have to get trained, try to open up a clinic and try to implement this and see how I can help other people. And that's what we've been doing. That's kind of, when a door closes, another one opened. And it was just such a great result that she had that I just had to learn this.
How long did it take you to get her totally healed?
She was healed within about 3 weeks of her treatment. Yep, of her treatment. And then it took about another 2 months until she was about 95% better. And then when we opened up our clinic later, there were a couple of things that I added on, which is like a detoxing of the herpes zoster virus. That's what we found out, that a lot of people that have trigeminal neuralgia with those shock pains usually have some kind of underlying Epstein-Barr herpes zoster virus. So when you address that, then you can now put that virus a little bit late, a little bit dormant, and then the pain completely subsided for, and she's been, pain-free now for many, many, many years.
What did all these doctors say after you healed her? They couldn't believe it?
Well, that's, yes. Unfortunately, a lot of times they're like, it was a one-time wonder. But we've had about 30 one-time wonders in our clinic since then with trigeminal neuralgia.
So what are some of the other things you treat?
So when we started and opened, we started with easy things. So knee pain, back pain, arthritis in the shoulder, frozen shoulders, tendinitis, all those different things. Because if you understand how laser therapy works, you can understand how it can help so many different things, because we're not treating the disease itself. We're treating your body and giving your immune system strength so that you can heal yourself. So we're about 100 trillion cells, roughly, depending on size, 50 to 100 trillion cells in your body. We're muscle cells, tissue cells, nerve cells, blood cells, and all these cells have a mitochondria, and the mitochondria is like the powerhouse of the cell. So I like saying it's like a flashlight and the batteries. The batteries is what we're charging. So when we give laser therapy, we're charging that mitochondria, the batteries of your cell. And now your cell suddenly works at full capacity, at least for a couple of hours. So your red blood cells get more oxygen and bring more oxygen to the area that we're treating. And, we know oxygen is healing, right? Mm-hmm. So it increases the T cell counts in the body. It increases, as I said, oxygen and blood flow and elasticity to the cells. Nutrients can come in now because the cell walls expand, and, toxins can go out of the cells. So there's a lot of things that are happening when we give laser therapy, but it's all non-invasive because it's just being, put on the top of your skin, and it's this warmth, this laser at specific wavelengths. There's specific, it's like 930, 905, 830 different wavelengths that we use, different lights, blue light, green light, red light, and laser in the visible and invisible spectrum. And so all those layers and all those things have a different reaction to the body. Some are better for the bones, some better for the nerves. So we've been doing this for so long. We have at least, I think, 6 or 8 different types of lasers in our clinic, and we've learned, which ones are better for which condition that the person has.
And how many people do you have that's basically doing this treatment? And what kind of schooling do they have to do this?
Sure. So as a laser therapist, you just have to be a CNA, and then you do a laser therapy training. Mm-hmm. So you do an education, and there's no real school to teach you that. But when you purchase the lasers, everyone gives you a specific training on how to use their device. So we've had training galore because we have all these different lasers. And I also use a different laser. It uses Comra therapy. That's coherent multi-radiances. And that's a device that uses laser, light, ultrasound, and magnet. So together with that combination is very, very good. It's actually a very small laser that we also sell as a home device. Many times patients come to us, they get the bigger treatment until they get accumulated and understand what we're doing. And they say, wow, I really like this. I'm going to get that little laser that you guys sell. And they call me and, say, Leslie, I have a headache. What do? I have this, I have that. And I kind of train the patients, tell them what to do. Mm-hmm. And they use this device, and people say they don't know how they lived without it before. So it's really awesome.
It's funny, I had a very good friend of mine, my cousin, who specialized many years ago when DNA came out. Mm-hmm. He went into what we call way ahead of his time. He did stem cell replacement.
Right.
And I never forget it. Matter of fact, his name is Roger Nacera. Roger, if you're listening, I bet you your name. He has a book that's called Cells That Heal You from Cradle to Grave. And one of the things that he recommended after you got your therapy, after you got your stem cell laser, was laser therapy.
Smart man.
Now, no one did I ever. Now I've had 3 sessions of stem cell replacement at a very, very high cost.
Correct.
$5,000, $4,000 for my knees. No one ever mentioned to me to go back and get laser treatment or acupuncture. Mm-hmm. It was both. It was a combination of acupuncture and laser treatment that he insisted you'd get after you get your stem cell replacement. So I can see, because now you work closely with physicians.
Absolutely.
You're not because she does this laser treatment, that doesn't mean that physicians don't send her referrals. because you can get a lot of pain medication physicians that say, listen, go see this young lady because she beside the medication you're taking, she can help you with something holistic.
Absolutely.
So
Or
tell us
even
a little
before.
about your referrals from some physicians.
Sure. So before you have surgery, it's very good to come in and get a health boost. So we're boosting you because we're gonna bring up your immune system. We have other little lasers that we use to bring up the adrenals, the carotid arteries, just to boost up your system. We have red light that we put you on, like the beamer kind of a thing on red lights. So we're preparing you for the surgery so that your body is optimally prepared to go through something like this. And then afterwards, we do laser therapy to reduce the swelling and the inflammation. So when a doctor, likes to refer somebody to us before and after, you get the most amazing results. The doctors themselves say, well, I can't believe how fabulous this is. I mean, you're healing much faster than, normally my patient would. And it's known that laser will reduce pain faster than opioids. So I really wish we could put that out there.
So you see these commercials, and I see these commercials where you want to grow here? It's like a laser therapy.
Right,
they use it to
exactly.
grow hair back.
Right.
So it's all about recreating those cells that are in your body
Yep.
for blood flow. Am I correct?
Correct. Absolutely.
I mean, even some of these ED clinics probably are using laser on some of these ED patients.
Yep. It's, as I said, right, we're all cells. So it doesn't matter. Is it hair follicle cells? Is it, blood cells? Whatever it is. This is just charging up those cells so we do the best that we can. Remember when we were young, 10 years old, right, we would fall, scrape our knee, we'd heal in no time. Well, that's kind of what we're doing now. When we're older, we don't heal as fast because our body isn't working optimally because there's toxins, we're tired, we have stress. So our body is using the energy that it has to, give us strength because we're tired, right? If we're optimally rested and we eat properly and we drink properly, we're just going to feel better. We're going to be able to heal better.
So let me ask you a question. How can people get in touch with you?
Well, you can call us, 561-405-9577, or you can go to our website, carmencarelaser.com.
Well, that's easy, carmencarelaser.com.
Yes.
And you'll talk to Leslie, and basically she can give you some advice. And I can tell you, some people say, well, how expensive is the treatment?
We try to keep it very, very affordable. So between $55 to $95 a treatment when you do a package. Some people want just 3 or 4 treatments. So we have a lot of top athletes that come to us, tennis players, tennis pros, and then maybe they put their shoulder out or something. They'll come for 3 to 5 treatments, and that heals extremely quickly. And they'll do 3 to 5 treatments in 2 to 3 days. They're back out on the course. So they'll pay like $55 a treatment.
So you can even do shoulder treatment?
Absolutely, yes. Acute
Instead of
and
surgery,
chronic.
like I have a friend of mine, he has a bad shoulder, he wants to play golf.
Yep.
But he doesn't want to get the shoulder operation because that's sort of long time to heal.
Sure.
Now, if he came to you, do you think your laser therapy might help that shoulder?
I would be very optimistic that it does. It depends if he has a complete tear. So if there's a muscle that is completely torn apart, our DNA does not know how to repair that. It does not know, to put 2 pieces together again. But if he just has a little tear where the muscles are
Full
still
muscle.
together, right? Then the DNA, our body knows, okay, let me just fix that and put, cells over that and decrease the inflammation. That will be absolutely very, very successful.
What about torn meniscus?
Yes, I've done many torn meniscus with extreme good results.
Well, that's fantastic. I think it's time for us to take a little break. So if you don't mind, we're going to take a 30-second break.
Sure.
We'll be right back with Leslie Carmen.
Thank you.
From Carmen Care.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, friends. We have a great show today, don't you think? What a different show we got tonight. We have Leslie Carmen of Carmen Care Laser. Now, I know a lot of us are out there suffering, especially at a certain age, knee pain, back pain, neck pain, all kinds of pain. Fanny pain, whatever kind of pain you got pain.
Pain.
We have Leslie Carmen here. She's telling you how to resolve that pain by calling the Carmen Care Center, Carmen Care Laser, and that phone number again, Leslie?
565-405-9577.
Now, I know there's a lot of devices out there that you can see on television. You put your feet on it, and it vibrates your feet and all of this here. So a lot of this stuff today is coming into the general public. But this is a young lady that's been here for 8 years. She even healed her daughter of a serious illness,
Correct.
a very serious illness, and that's how she got into the business, as she told you. But, I'm sure you've treated a lot of patients, and we have one patient in the audience today that would love to give a little testimonial, and I believe his brother is going to Leslie Carmen, correct?
That's
I got Ed Salazar. Ed, tell us a little bit what has happened to your brother.
Well, when I met Leslie, and she told us a little bit about, how laser therapy works, and like to assist in the regeneration of nerves and tissue, skin tissue, and such. And I thought about my brother, who he had a severe compound fracture of his ankle about 8 years ago. And, they put it back together with screws, like the traditional methods. And a few years ago, he started having difficulty with the hardware. So he had to have a surgery. They took it out. They did a fusion, but he never healed properly at all. He had edema, swelling. He started... the neuropathy was extremely painful. So I thought, well, maybe he should give this a try. He went, and he took the first course of 3 treatments, and there was a measurable, remarkable improvement in the color of his skin. So circulation was improving. The dermatitis, was getting better, and he was definitely getting relief from pain without opioids.
Well, that's fantastic. So
Thank you.
One of the things you do, people are on pain, they get all these opioids, and some get addicted.
Yes.
I know a friend of mine got addicted because of back pain. He got addicted to that crazy drug. What is that?
Oxycodone.
Oxycodone, right? That Oxycodone drug. And I hired him many years ago. I thought he was a great athlete, all-American athlete, football player. And I thought he was a great salesperson, but he got hooked on this Oxycontin from back injury. And he lost his family, lost everything.
Yes.
So you basically say without opioids, without anything, you could take people and basically relieve some of their pain.
Yes.
Okay.
And we've actually done that. We've done that under supervision because, as you know, I'm not a doctor. I'm not allowed to, touch medication, anything like that. But with the supervision of the doctor, we put a plan together and we give treatments, and then the doctor can very, very slowly reduce the amount. And it takes a while. It takes a couple of months. But my biggest success story was a woman was on, I think, 565 milligrams of morphine.
Ooh.
that would just kill an elephant. And she was this little ballerina coming in a wheelchair. And just when I first met her the first time, we just all cried because she was just unresponsive. Her husband and I just looked, and it was just terrible. And so we made the plan with the doctor. It took about a year, but we got her off to 0. And she was completely different. When she would come in, she'd hop up on the bed now, and she could walk. She was getting out of her wheelchair, was able to walk and actually have lunch. And the husband would hug me and thank me and say, I have my wife back. And that's just not one case. We've gotten a lot of people off their drugs, which is so important.
It is, because, once they get hooked on that opioid stuff, they seem not to get off. The other question I want to ask, beside treating these individuals, how long does usually a session take? What would a session encompass?
Right. So that's a great question. Now, it's a difficult question to answer because everybody has their own healing response. So you have some people, they come in and let's take an average person that is an athlete. He exercises, he drinks lots of water, he eats healthy, he has vitamins. Somebody like that is going to heal much faster than somebody who's, let's say, maybe 60 years old, who's been a smoker or a drinker. Not that I oppose of that, but I'm just explaining how the body is. It's going to put a lot of stress on the body. You're not sleeping well. You maybe have, family issues. So you have a lot of stress going on in your life. So a person like that is going to need more time because we have to actually look at other things as well. We have to look at lifestyle. We have to look and see, do you need extra vitamins or whatever that picture looks like. But it just depends what you're coming with. What symptoms do you have?
So you do a plan of care.
Correct.
And this plan of care is looked at by the physician.
Yes, correct.
The physician will authorize the plan of care.
Yes.
And once that plan of care, you make sure that patient follows that plan of care.
Exactly.
Okay.
And we have also a chiropractor. We have an acupuncturist physician, so he can do muscle testing and see what kind of foods are good for
All
you.
in your facility?
Yes, all in our facility.
So you have the whole works.
We do. I work with a group of people.
All right.
Yeah.
So is that all under your supervision or the physician's
Yes.
supervision?
Yeah. Yep. We're all just together as a team.
So they
and we
don't
go
have to
through
go multiple places?
No. We also have a massage therapist who's a part of our team now, but she's an orthopedic specialist. So we've added that. So we're trying to get in more and more people. We're bringing in someone new as a PA. He's going to do IVs.
Where is your location?
We're on 2nd Avenue in Boca Raton. So
Okay.
just a little south of Spanish River.
Second, and what in that building, that group of buildings on the right?
It's on the west side. There's like I think his name is Herman Law or Berman Law. And we're across the street from Plumtree Plaza.
Plumtree Plaza?
Yes, across
Are
the
you
street
on the
from
west
there.
side?
On the west side.
Okay.
Yeah.
So what's the address again?
3301 Northwest
Do
2nd
you take
Avenue.
walk-ins?
Do we take what? Walk-ins? Oh, well, yes, we've had walk-ins. Just sometimes we're, especially now with COVID, so we're very, very careful. We have a very big facility, so we just have one person in the waiting room and everybody in their room, so we try to separate everybody. But yes, I mean, if we're not full, we absolutely take walk-ins.
Now, during this COVID period of time, I understand, and I was listening to the news today, tremendous amount of children, tremendous amount of people are under a lot of stress.
Correct. Absolutely.
I mean, they're talking about these kids that are not going to school.
Mm-hmm.
They're getting obese. They're getting this. They're tremendous amount of stress.
Yeah.
They're not studying as much. They're not doing as much work. And I think that's going to create a problem for a long time.
It sure will, and that's something that we offer as well as Reiki. So Reiki is a Japanese healing art to bring energy and to just really focus and to to bring healing to yourself. And then we also do something called Psyche, where we reprogram your belief system. So, like, basically, if you have a thought that, I'm stressed, or I'm not good, or I'm not good enough, I'll never make this, we try to reprogram your brain so that you believe I'm good enough, I'm successful. So those are patterns, those are positive affirmations.
So you're doing a lot of psychological coaching.
Yes, in a sense, yes, but just under what I'm allowed to do. But I'm a Reiki master, so I'm allowed to do that.
All right.
And it's a very nice way to bring peace and harmony to the people that come in pain.
Well, I know out there, I know that all you people that are listening, I'm sure that 99% of you have some kind of ailment and could use the services of this young lady. So I strongly suggest, we have a few more minutes left, I strongly suggest that you go see Leslie Carmen. She's the CEO and founder. She told you she comes from Zurich, Switzerland. And you know how well Switzerland is as far as their medicine.
Absolutely.
They're one of the tops in the world as far as as
Yes.
outcomes.
Right.
Right?
Yep.
And I would say your outcomes are pretty good, aren't they?
I would say yes, if I may say so.
So what's the most important thing about medicine when you're practicing medicine is outcomes.
Absolutely.
I mean, no matter what physician you go to, if he does your knee, what's the outcome?
Right.
If you can't walk after knee surgery, the outcome's not too good.
Nope.
So
And this
with
is
your
good
situ-
outcome. No side effects. That's the most important.
No side effects.
No side zero.
And there's basically, you're
No
not
risk.
addicted to nothing.
Nope. No risk. No side effects.
And they can leave at any time.
Anytime.
There's no, I mean, if they want to leave, they.
Oh, sure. Yes.
So
yes.
there's
for
no
sure.
contract they're going to
No,
sign for long
never,
term. All right.
never.
So remember, what do you got to lose? $55? That's the cost of a dinner. But I think it's worth it if you go see Leslie Carmen. Leslie,
Thank you.
how much time do I have left? They tell me I don't have enough time.
That went so fast.
Well, Leslie, thank you for coming. You're welcome anytime to come back.
Thank you so much for
Thanks
having
a
me.
million
Lou.
for coming.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of the